Speaker. I rise this evening, colleagues, to offer an amendment that will prevent the privatization of community mental health services in Michigan. We don't have to look far to see what happens when we privatize important services like mental health in Michigan. At the Grand Rapids Home for Veterans, allegations of abuse and neglect swiftly followed the privatization of personal care services for our aging and vulnerable veterans. We can't let this happen to mental health. When prison foods were privatized, we heard of low-wage contract workers having sex with inmates and smuggling drugs into prison. That's the legacy of privatization. We can't let that happen to mental health. So when the idea of privatizing community mental health services was raised last year, people receiving mental health services and their families were concerned. They raised the alarm, and the plan was stopped in its tracks. So here we are, once again, addressing a critical service in terms of debits and credits. We are looking only at the bottom line, not what's best for our friends, neighbors, and family members. Dismantling local community mental health does just that. My amendment restores the promise of delivering high-quality public community health. When I first started knocking doors a few years ago, I thought I was talking about schools, infrastructure, revenue sharing, and I quickly learned just how important community mental health was. And every coffee hour I have, every town hall I have parents who are now in their 70s worried about their children who are in their 50s because they are bouncing between prison and jails and substandard housing because they are not getting the services that they deserve with mental health. Because we have systematically reduced our funding of that, and this amendment tries to stop that downward spiral for mental health. This budget will divert additional money to administration and profits, not to improving care to our most vulnerable citizens. Our loved ones who need mental health care deserve the best we can give them, not the lowest wage worker we can find. Vulnerable adults needing mental health services are our neighbors and our family members, not profit centers for HMOs who donate to political campaigns. We know privatization erodes the quality of care. We've seen it happen to veterans and at state prisons. We don't need to see it happen at community health centers too. I ask for your support for this amendment. Thank you, Mr. Speaker.
Thank you, Representative. The question before the House is on the adoption of the amendment. The clerk will open the board. The amendment is not adopted.